Compression. So compression gear, abdominal binders, compression sleeves, squeeze. So has been a study that showed only about 15% of people with orthostatic disorder, especially POTS patients, use this gear. It can be challenging. They're hot, they're uncomfortable, they're cumbersome, they can be expensive, they slide, they're painful, they're sweaty. It might not work for everybody. If they were that helpful, maybe they would be used more. The studies for them have been problematic, so they're hard to study, and we could probably do better studies. So that's the hard reality about compression gear. There can be better research. We do talk about them, but maybe there can be better ways to investigate them for clinical benefit for patients. So that's important to bring up to patients. The data is probably messy, and maybe it's not as straightforward as we think. So this is where we are. And I bring this forward to you because patients are like, what do I do with them? So people have maybe more tendencies for those orthostatic disorders where they have hyperadrenaline or hypertension as a response. They want to drop their blood pressure, but they super surge. It might not benefit those people. Those who really, really have low blood pressure and they have a tendency to stay super low and then they need medicines to stabilize it, they may be the ones to benefit the most. And you really have to customize it. Often people may start simple with some retail ones they can buy online or in the store and just see what feels comfortable at low pressure because they can be painful, what they can tolerate through the day. To say how much can I do? Starting maybe initially at knee high and then go to thigh high. Usually the ones that are most effective, believe it or not, are the pantyhose that go over the hip and with it or abdominal binder. It can be very challenging. So it can be very problematic for people to find what works. So if you feel frustrated with it, then it's maybe not for everybody and not always the most successful. And so it's a lot of trial and error. If you find that it may be a problem, another maneuver you can do if you go to our video channel is the legs on the wall maneuver, where you lay on the floor on your bed, just put your legs up on the wall, just get the blood out and push it up to the vertical area. There's a video called Legs on the Wall. So there's things you can do with restorative yoga or the legs on the wall maneuver that can really give you some relief, get that blood out of the legs that level if you don't want to compress. So I just wanted to at least bring up some sympathy and understanding of the challenges of compression gear, that they may not be for everyone, and the data is messy and not so straightforward, and to have some understanding for everybody. So thank you.